This is my client. This is her second visit, and we're keeping her face out to preserve her privacy. And she is an attorney and came from far away. And she has had episodic physical therapy for how long?
Oh boy, 30 years.
30 years, okay. Well, what was the onset? Why did you have that as a child?
Initially, when I was around 13 or 14, I was a swimmer, and I developed tendonitis and bursitis in both shoulders.
Oh my!
Due to laxity and instability in the joint and overuse and
Interesting.
repetitive motion. So that's initially my first foray into physical therapy.
Staying with the shoulders, now 30 years later, what did we do with your shoulders today?
It was really magical. You
did the most simple thing. I found tightness in your AC joints, the acromioclavicular joints. Obviously your pectorals were tight, but freeing up the pectorals wouldn't have solved that. I showed you that there was inhibition, not weakness, but I mean it tested weak, but it was inhibition, it was neurological, of your upper back, of your rhomboids, thoracic erector muscles, and the middle trapezius. I'm sure they've had you strengthening for a long time, for that part of your body.
Oh yeah.
It didn't work.
Right.
I was able to, with you on your stomach, you lifted your arms up sideways, I was able to so easily push them down. I had you lay on your stomach. I put a 2 by 4 by 8 inch piece of foam, half moon, under each shoulder. Okay? That simple. I placed it at a 45 degrees from the bottom to the top facing towards your ears. You laid on that for 5 minutes. After that, I could spring the AC joints obliquely. And then I tested your strength, and you were 5 out of 5.
Yeah.
And how did you feel after that?
It was almost unbelievable. I felt good. I mean, my shoulders felt unrestricted, and I'm a side sleeper, so I know that I tend to get this kind of compression just in my daily life, but it feels expansive through here.
Nice.
And stable. When I resisted your downward pressure that way, I felt strength without a feeling of compromise in the joint.
Compensation? No compensation?
It was, yeah. Like
nice.
Effortless strength.
So we treated the nervous system.
Yeah.
You know, and I'm sure some people would look at the video where I demonstrate that technique and say, he just puts a piece of foam under the body. You know, and I'm like, yeah, but it was pretty intelligent, pretty awesome what it accomplished, you know, and guess what? You're on your own now. You do that once a week for 3 minutes and you'll be fine. You won't need, you know, to keep trying to strengthen what you can't strengthen because it's inhibited.
Right.
And the pectorals will release. Little massager could be helpful. You know, maybe there's a little more work to be accomplished there, but it will be lasting. Yeah. Now that the joint inhibition from the type 3 mechanoreceptors is no longer happening. Yeah. This was a nervous system treatment as much as it was a biomechanical treatment. Yeah. Okay? Good. We also treated your jaw today. There was the subtlest side bending pattern in your mandible, and I just very gently distracted the jaw with you laying on your back with your neck in a little bit of extension. That was 3 minutes. And how did you feel after that?
Wonderful. Pain-free, unrestricted movement in my jaw, which is unusual for me. I usually feel one side is a little different than the other. Or there may be some hesitation, some tighter spots, some sticky spots, some, you know, lateral movement as my jaw opens and closes. And I felt none of that. It
Wonderful.
Was really
and I don't think you told me about your jaw.
Yeah,
I stumbled on it because I always clear it on the second or third visit. And so I checked it out, and it was the most subtle restriction, but we both agreed it was there. It was present. Do you feel like you now know how to treat your jaw?
Yeah.
Nice. And ideally, your husband can help you once a week for 3 minutes on your jaw?
Definitely.
Nice. And so just one visit for your jaw, and that's it. Yeah. There's a lot of work on jaws internal, in the mouth.
Yes.
I mean, sorry, but if you put your finger on my mouth, I'm on alert.
Yeah.
I'm on high alert.
Yeah.
Hard for me to relax. And there is a place for doing work in the jaw. I'm not denying that. Okay? And if the muscles, are real tender, they might release if you do the most gentle pressure against the muscle belly or against the tendon or even the ligament. That can have a very positive, lasting effect.
Yeah.
I don't believe in being forceful.
Yeah, I've had some work done by
Okay.
massage therapists. I know we talked about Rolfing the last time I saw
Yeah.
you. I know that's part of Rolfing too, is to do some internal work
Uh-huh.
on the masseter and some other
Right.
muscles sometimes.
Yeah.
And I've gotten some relief from that, but this is a very different feeling. You didn't have to go straight to a muscle that was on fire from being overworked or being in a hypertonic state. Just very gently. It's the nervous system component. I think, you did address the muscles because things feel
Right.
different, but you did it in a very gentle way that I think my body was really responsive to.
Yeah, I think your body will keep it.
Yeah.
I think if you do nothing and come back in 6-8 weeks, I doubt that I'll have to treat it.
Yeah.
I really doubt it. And you can just make sure that every week by doing the self-treatment once a week or having your husband help you once a week.
Yeah.
But honestly, I think it's going to stay.
Yeah.
And if you get to where you feel like, it's just not doing anything when he does that treatment, it's just neutral, then there's no need to do it. Then you could skip a few weeks and.
Yeah.
But you're independent now, and that's my goal of treatment, is to make people independent in 1 or 2 or 3 visits. And you're a 2.
Yeah.
I think we accomplished much with you that will stay.
Yeah.
And I'll teach you self-treatment for some of the other patterns that we had. I did forget to do that.
Okay.
You had a twist in your pelvis. And the nomenclature is right anterior ilium, left posterior ilium. It's not based on how it looks. In my model, it's based on blocked passive motion testing.
Okay.
And you had that on both sides. People blame the SI joint. No. That is a pattern of the entire pelvis moving with the trunk, with the spine, and moving on and with the hip joints. The top of the femurs is ovoid shaped. The hip joint is round, kind of round, and it's a pattern there. Okay, it's not the ilium rotated on the sacrum and got stuck. If that was true, then there would have been a discernible shift in the pubic joint. You didn't have that.
Okay.
There would be a difference, there would be a restriction of pubic mobility tested passively, and much of that you can test in the ischium when you're on your stomach, because the ischium becomes a pubic joint. Becomes a pubic bone. But anyway, we balanced your pelvis, we restored that movement. And then we also treated a left side bent tailbone. And we treated a compressed 12th rib. Aren't you the odd one that it was compressed laterally, the 12th rib? And you're like the 1 out of 30. The rest have it compressed medially towards the spine.
Yeah.
But we treated it successfully. Today it's gone. It'll stay gone.
Yeah.
And I'll teach you the self-treatment for that and for the twisted pelvis as well, just for future reference. Okay? But tell me how it felt to balance movement. Oh, your left hip lacked extension.
Yes.
It only extended 5 degrees?
Yeah.
Okay. Whereas the right one went easy 25 degrees with kind of a soft spring. Okay. So we restored that movement very simply. You can see my technique on YouTube. Just look up hip extension Hesch, and you'll find it. Last name is spelled H-E-S like Sam, C-H. How did you feel? You came in today giving me real positive feedback about that.
Yeah.
How did you feel balancing the hip and the pelvis?
What I feel, I think the best way I can put it is that moving takes less effort. I can just get up and walk or stand up and feel like my bones and joints are organized without me having to think about placing them in the right place.
Wonderful.
which is something that I've always kind of been very aware of when you
Yeah.
have low back pain, or try to figure out, is it a postural issue, is it a movement issue? So I'm very aware usually of where I am in space and how I'm moving, and now I don't even have to think about it because everything feels effortlessly organized, and I feel like the joints are all moving freely without, restriction or tension or pain.
Which is how they should be.
Yeah.
And your posture should be effortlessly organized.
Yeah.
Posture should not be something, I have to consciously arrange my body in space this way.
Right.
No, it doesn't work that way, because as
Right.
soon as the phone rings, it's all over.
Yep.
Okay?
Yeah.
So no, it should be an effortless expression of your nervous system, not something you have to bang away at.
Yeah. Yeah.
So then today, after treatment, I showed you some really simple ball exercises. We covered how to bend, lift, twist. And probably the biggest thing we did was just encourage you to point your feet out slightly. That seemed to open up, better connection between hip and spine
Yeah.
and pelvis.
Yes.
So that was what we did today also. And I feel like 2 visits is going to be it for you. And we screened your whole body. We forgot to talk about your tailbone. Your tailbone was side bent left. And very few clinicians know that the tailbone can get stuck in side bending.
I didn't
And
know
we
that.
treated it.
Yeah.
And we found it externally with external palpation and external passive spring testing. And we treated it, and it remains corrected. And tell me, what was the outcome of us treating your tailbone?
I had, before we treated it, I was aware of some discomfort. I wouldn't say that it was acutely painful, but I consistently felt a sensation on my left, just left of center, deep in my pelvis, that I didn't feel on my right side. And it was pretty much always there with movement or with, stillness. I felt something different, and I've done pelvic floor therapy, I've done all kinds of different, body work modalities, and nothing ever really addressed it.
And how much pelvic floor PT did you have in the last 3 years?
Oh, let's see, it's been a couple of years, probably 3 years ago. I saw a therapist once a week for a couple of months.
Okay. Did they ever comment on your tailbone?
No.
No.
Not
Okay,
at all.
interesting.
Not at all.
Interesting. Okay.
Yeah, and I've had lots of massage therapy and dry needling in and around that area, and my
Yeah.
glutes, all that stuff. Nobody ever took a second look at my tailbone.
Interesting. And some internal practitioners say that it's side bent right when it's actually side bent left. And they're encountering the transverse process of the first coccygeal segment, which is lower on the right side.
Yeah.
And they're thinking that's the tip of the tailbone. It's not. And I evaluate it externally. And I find a deeper sulcus on the left side, which indicates that transverse process is elevated. I test mobility by trying to spring it left to right. And motion is blocked and I'm only doing about 3 to 5 pounds of force. And then I come on the other side, but I'm able to spring it a little bit to the left, so it can actually go further into the pattern where it is.
Yeah.
And it's not a pure side bending. There is a rotation that couples with that. It's too subtle for me to evaluate. Some clinicians claim to be able to evaluate the rotation of that, and I'm like, not me.
Yeah.
Not me. I don't have, I'm not that skilled, and that's a very high level of finesse, And then I check ligaments, and I find the right sacrotuberous ligament to be taut, very tight and more prominent when you palpate it. And all of those things go bye-bye. And the tailbone seems to correlate either at the SC joint is a compensation in the body. That seems to be where the body compensates for it. We don't know why.
Yeah.
We don't know why. I mean, C1 would be a lovely place for it to compensate for a variety of reasons, and that's a common place for lots of patterns in the lower body. But for reasons I don't really understand, it's at the SC joint.
Yeah.
I had a PT friend, and She was a PhD neuroanatomist. And I would ask her these questions. Why does the body do this? Asking, manual therapy questions. And she knew immediately what the answer was biomechanically and with respect to neurophysiology, neuroanatomy. I mean, she didn't blink twice before she answered it.
Smarty.
Yeah, so I need more of her. I've got some questions. Yeah. So what are your thoughts on this Hesch approach to the whole body and to treating joints?
Yeah. I've been searching for this for decades. I think I've been chasing pain relief and looking for increased efficiencies in the way I move and the way I am in my body. And I wish I'd found this 20 or 30 years ago, but I'm glad I found it now because I really feel very different in my body. And even though it feels like very subtle work. You're not cranking things around and making things click and pop.
Yeah.
But I feel more stable in all of my joints. I feel less pain throughout my body. It's really been remarkable. It's kind of surprising to me how well it has worked
and
for
how
me.
Incredibly simple it is.
Yeah.
My treatments are very precise, but very, very simple. Very direct, in an intelligent direction, small force, sustained.
Yeah.
Every treatment I did to you lasted at least 2 minutes. Some were 3, some were 5.
Yeah.
But that's a long time if you compare to a popping a joint, which is measured in less than a second.
Yeah.
So anyway, really interesting presentation you had. And it was a whole body approach. We had to treat stem to stern or nose to toes. Yeah. And I think that's it. Any final thoughts?
Oh, no, I'm just incredibly appreciative. This has really been so beneficial for me. And
nice.
I'm amazed and grateful.
Nice. And first visit was 1 hour and 15. Today we're at 1 hour and 15 by the time I teach you the self-treatment for the other things. But that's it. You're done. If you ever need to come back, you're welcome. Contact me. You can come back.
Okay.
But I like to wrap it up. Yeah. This is a definitive treatment approach. I call it interventional manual therapy. Get in there, do good manual therapy, get out, make them independent, call it a day.
Yeah, I appreciate that.
So it's on my headstone, it's going to say, he had a very bad business model.
Yeah.
Every night my wife gets mad at me. Your damn business model, they're not coming back.
Yeah.
Maybe I'll earn my way to heaven. Maybe I'll get some brownie points because I need them. This middle child needs brownie points.
Yes, and validation. And
don't get me started.
Oh, I know. My husband's a middle child too.
Oh, I bet he's a picnic every day.
Yeah.
He's a barrel of fun.
Oh yeah.
Very good. Well, tell him I feel a sense of kinship. Thank you so much.
Thank